good evening and a very warm welcome to the Ambassadors Industry Meet. It is my absolute pleasure to welcome on the dais with us our esteemed panel excellencies. We have with us His Excellency Mr. Hissein Oumar Seidou, Chargé d'Affaires, Embassy of the Republic of Chad. His Excellency Mr. Nazar Mirjan Mohammed, Chargé d'Affaires, Embassy of the Republic of Iraq. His Excellency Mr. Sahidou Tanimoune, Chargé d'Affaires, Embassy of Republic of Niger. His Excellency Dr. Mohammed Abdalla Ali Eltom, Ambassador, Embassy of Republic of Sudan. His Excellency Mrs. Harisoa Lalatiana Accouche, High Commissioner, High Commission of Seychelles. Dr. Upasana Arora, Chair, FICCI Medical Value Travel Committee and Managing Director, Yashoda Super Speciality Hospitals. Dr. Raajiv Singhal, Co-Chair, FICCI MVT Committee and Founding Member, Managing Director and CEO, Marengo Asia Hospitals. Dr. Narottam Puri, Advisor, FICCI Ayush Committee and Chairman Emeritus, Multani Pharmaceuticals Limited. And Dr. Raajiv Singhal. Let's have a huge round of applause, ladies and gentlemen, as we welcome our esteemed excellencies on the dais. Without further ado, we will be starting off with this session. And to start off with the proceedings, it gives me immense pleasure to hand over to Dr. Raajiv Singhal, sir.
Thanks, Eltom. Very good evening and warm welcome on behalf of FICCI to all the excellencies, all the ambassadors, our guests who have joined us for this important session. The entire concept of medical value travel will be incomplete without your active participation, without us getting the inputs from you, and without us trying to bridge what are the gaps between the people who are trying to create this ecosystem of medical value travel. Without wasting time of all the dignitaries, I would actually start by asking certain questions from all the members who are present here so that they can help us in trying to understand what are the expectations of them, their countries, how we can actually provide and improve medical value travel between the two countries as we progress forward. My first question is to His Excellency, Mr. Oumar Seidou, who is Chargé d'Affaires, Embassy of Republic of Chad. Sir, considering that we are looking at extending a relationship in the medical value travel, and there is definitely the need for both the countries, considering that in few Indian hospitals have already started creating center of excellence in Mongolia, in Kenya, and we are looking for creating more center of excellence from the concept of expansion and capacity building in the countries. What is your view about this entire concept of medical value travel and what we can do?
Yeah, good evening, distinguished guests, and thank you for FICCI for inviting us to take part of this important event. Excellencies, ambassadors, CEOs, and FICCI's leaders, chairman. For us as a Chad, we value all those medical tourism, and nowadays, as you know, that India has become the biggest destination for medical tourism of our citizens, especially from the global south. If you can see, I'm from Chad. Currently, we have around 200 or 300 patients. Actually, I'm saying in Delhi and also in some part of India. You can get Hyderabad, Bangalore, and also Mumbai. Even there, some they are going to Chennai and other parts of India. For us, as you mentioned, the establishment between Kenya and Mongolia, the view of Chad, we need also to have some kind of joint collaboration between Indian hospital and Indian group of health to our parties. And these things could be focusing on 5 things: establishment of center of excellence, as you mentioned, The second thing, we need support in terms of capacity building for our doctors and also building our structures, like upgrading the system. Because why I'm saying that, we cannot bring all the people because there's not all those people who can afford tickets. If you see the travel distance and other things like the facility, is huge. But if we establish cooperation by implementing, or some hospital can work on the ground or help our doctors to upgrade their skill, it could be a good benefit for the both parties. And also, in this regard, nowadays we have tools. So we can use telemedicine, e-medicine to exchange directly and also helps our doctors to interfere. Even there's some barrier regarding language issues. And also we can work in the joint research and development between the two parties. And there is one, the public-private partnership. In this regard, we are calling for stakeholders in the medical system. We have a good facility for them to intervene in Chad, especially to build up the hospital or creating something in the ground. In other fields, like now we are facing also, we are calling you guys as actors in the medical, especially from India. We are calling you to take also some consideration. It's rest in the ground, as you mentioned from our citizen here in India. If India can help us to get instead, to make same layout instead of having international patient and local, if there's little bit transparency and also affordability regarding the treatment. We are trusting the Indian quality of treatment is very well. All our people, they have a good impression, and most of them, they're coming now, stranded now. And really, I'm telling you, there's around 200 visas for medical tourism monthly from Chad to India. But the only one thing, if we can have a good collaboration in terms of having the same rate accorded to the Indian local people for the international patients, could be the best things. And the last one is related to issue of language barriers. Because as you know, like India, our people is not, most of them that are not speaking like international language. And they are facing translators issues, and I know that's why it's affecting the cost of the treatment. So we have some students here, and my recommendation to hospital, if they can hire them and use them as local translators, they can use to translate for other patients and also for our specific community who speak in their local language. Thank you so much.
Thank you, His Excellency, Mr. Hissein. I couldn't agree more on the concept which he mentioned, which was very important. And I think that was the cornerstone of the FICCI's chapter, which was included, that the concept of clinical corridor, where we are looking at 3 T's: teach, train, and treat. It is imperative for us as the value providers that we also think about creating value in your ecosystem. Not everybody from the country can travel to India or vice versa. The most important is we need to find ways to partner hospitals, where hospitals can come and also help in trying to train your teachers, your doctors, nurses, technicians, build the ecosystem. Then only this partnership is going to progress. So I think you made a very valuable point on this. Thank you. The next I would move to His Excellency Mr. Nazar Mohammed, who is Chargé d'Affaires Embassy of Republic of Iraq. And I would again have one simple question to you. Iraq has been a very important country as far as medical tourism is concerned in India, and we have a lot of good relationship between the two countries. People trust each other, people travel seamlessly between the two countries. The faith which people have on the Indian doctors is immense. I value that, and I want to thank you that your people have a lot of trust on our ecosystem. At the same time, how do you think that what specific measures we can take to improve this experience between the patients who are traveling in these between two countries? Over to you, His Excellency.
Thank you so much. Firstly, I want to thank FICCI to organize this event and this panel. It's very important for us, and I would like to thank all the panelists and the audience also. And I would like to express for our condolences for the victims in Jammu and Kashmir. Yes, sir. As you mentioned, we have a very good relation. We have a very historical relation with India. We have a lot of similarities regarding the value, the culture, the trade exchange from long time ago. And the Iraqis, when they arrived to India, they integrate with the society directly. And we know India from long time ago regarding the spices, the textile. And I myself, I have an experience when I entered my university in the 80s of the last century. We had 3 profs as a lecturer in our university, Indian profs. So our culture exchange is from long time ago. The trade exchange from long time ago. The society have a lot of similarity. And we have very common values. Return back to the medical tourism. In our registration, we have around 40 to 50,000 Iraqis every year come to India to have the medical treatment. Mostly they have the treatment here in Delhi, and also they attend to Hyderabad, Ahmedabad, and to Chennai. A lot of cases, it's a transplant cases for kidney, for livers and lungs, and we think we can improve this number of people that they take the medical care here. But also, I agree with you and my colleague from Chad. If we can have an Indian hospital in Iraq, it will be a good idea. I discussed this issue with the Minister of Health, Iraqi Minister of Health, and we discussed several issues. One of them, how to engage with the Indian hospitals that can make surgeries in Iraq. Many surgeries we cannot do it in Iraq regarding the equipments. We don't have the technology. So I believe now, with this long time experience, we can start the engagement to help the people who cannot travel by airplane to have the treatment inside Iraq. And when we talk about this issue, they will save the booking of the flights. They will save the booking of the hospital for the people they accompany them in the hotels, and the other a lot of issue. So this is one of the initiative we can start doing with it. The healthcare system in Iraq mostly is public. We have now a lot of private sector hospitals, and it's very new, and we have started to expand more. In India, most of the hospitals, I believe it's a private sector. So we need to make the engagement between the two private sector. The other issue we faced with the Iraqi patients, they know the hospital or the doctor through the interpreters. And sometimes there is a good number of cases, the interpreter didn't give them the right advice. They just want them to come to India to have the treatment. And when they arrive, they found out they didn't need to come. This is one of our topics to solve this problem. The other problem, I don't know about how many interpreters that they are specialists with the medical issues, because sometimes the interpretation, if you don't have the knowledge of the medical phrases or terms, and you cannot explain to the patient the right case he faced, it's a problem. And to be honest, most of the Iraqis, they arrive to India, they do not know English. So they follow the interpreter from A to Z. And when they told them sign this paper, they sign it directly. And they don't know what they are signing. We have an idea, we have a culture attaché. Unfortunately, he's traveling right now, Dr. Mohammed. We arrived together last year, so we spent now 1 year. We have a lot of point of views that we can solve these problems, and we can minimize the number of the cases that they're suffering from the bad interpretation or something like that. One of them, we need the hospitals to inform the embassy any patient attend the hospital, because that will solve the problem for both of us. Because we have a lot of cases. The patient came and he thought he will spend like $3,000, but his case needs $7,000, and he will have a very big problem with the hospital and the financing issue. So we need to organize. We have 40 to 50,000. It's a good number. And also, I talked with several tourist people. If they can make, if they can open an offices in Iraq and give them a chances. I met with one of them. He informed me that she's a doctor, she's a lady, and she's a doctor. She informed me that she gave 3 choices with 3 different costs to the patient before he come to India. So that will be helpful for them. I don't want to take much time, because if I would like to talk about all the cases we faced, we need a lot of time. Thank you for now, and I am very happy to be here, and really would like to thank you again, and thank FICCI for organizing this event. Thank you.
Thank you. Thank you, His Excellency, Mr. Nazar. I want to just take 2-3 points which you mentioned, and I think they are very crucial, and I'm only utilizing this forum or the meeting to address a lot of common points, because the idea is that one of the excellencies will always come up with a point which is crucial for everyone to as a take back message for us. So you mentioned one thing which was an extension to His Excellency from Chad, who said, can we do capacity expansion, and you mentioned. I'm just happy to inform you that from Marengo Asia Hospital perspective, last 2 months we have done around 40 odd surgeries in Iraq in a hospital. We realized this problem and we have extended this entire concept, and we have done that. So that's what exactly we are doing. And your neighbor, in fact, I'm waiting for His Excellency. Tonight my doctor is traveling to Nigeria to do surgeries in Nigeria, because this is what we believe in, this is what we are trying to do. The most crucial component which you said, and which touches everyone and all the people who are here, is the communication and transparency. If we keep our communications right, we are transparent in everything, that will lead to building of trust, today what we are getting around 50,000 odd patients, these patients can go up. And the other aspect you touched, and that is for the people who are, for the industry to look at, the people who are doing the job of interpreter, whether they have adequate knowledge about medical interpretation of certain things. That's the most crucial component. What doctor is telling, it's not always English. There is the science behind this English, which is crucial and important. That is where the communication gap takes place. That is where the pricing changes from $3,000 to $7,000 because somebody was unable to interpret, inform the medical condition or the comorbid condition. So I think this is the important takeaway message, and all the people who are here, they should try to have some kind of a training for all the people who are involved into this. Once again, thank you, His Excellency. I think these were very good, and I also sincerely appreciate you condemning the killing and being extending your support to the country in the time of crisis. Thank you very much. My next question comes to His Excellency Mr. Seidou Tanimoune, Chargé d'Affaires Embassy, Republic of Nigeria. Sir, again, all the people we have had great relations, great countries, people actually gel well, very well. People have been traveling to both the countries over a period of time. There is an element of trust which is there. I think the time has come where we need to strengthen the element of this bridge for our future journey together. The question from my side is that Nigeria, we have been engaged in initiative including establishment of Mahatma Gandhi International Convention Center. We've established that. We've been participating in the e-network project also in Nigeria. We just want to understand what are your expectations and how the embassy can help us in collaborating with our partners in much stronger and organized manner. Because somewhere what I'm hearing the voice from the table is that how we move towards creating a much more organized, structured piece of engagement from the industry and from the embassy. Over to you, sir.
Okay, thank you. First of all, I would like to essentially apologize for the delay in coming. So I thank FICCI for organizing this important event. So I want also to use this occasion to extend my heartfelt condolences for the event that occurred in Jammu, Kashmir. Okay. Donc, in regard of the issue between the partnership between Indian and Niger medical tourism, so the embassy is doing its best to facilitate the coming of Nigerian to medical tourism in India by facilitating the visa and other facilities and documents required by the hospitals here in India. And we also thank the Indian partners for their trust, and we encourage this partnership, and this partnership deserves to be strengthened by close collaboration, so that the two sides can get benefit from this partnership. Thank you.
Thank you, His Excellency, and I would actually request Dr. Narottamburi sir to say a few words about certain common points which were highlighted so that then I'll move to the next round.
Thank you. Thank you, Raajiv. Just a couple of points which emerge out of the three excellencies that we've heard. One is the point of cost and the lack of transparency thereof. I think it's important that the education be provided to the patient through various means, including probably from the high commissions and embassies themselves, is the type of hospital that they must look for which provides value. Cost is not the only thing. Does it provide value? So that's the difference between cost and value. that the patient needs to understand and that needs to be delivered. The other thing is that often the patient does not know where to go, as was pointed out, that they rely totally on external factors which are beyond their control. So that's why the price variation varies, other than the fact, like Raajiv mentioned, about the absence of details available in advance, which means that you might have comorbidities. For example, if you are coming with a diagnosis of a certain type of cancer for treatment, but you also have a heart block, and therefore you first need to get a pacemaker put in or a stent put in before you can think of treating the cancer disease. Now this is not known. So therefore, sometimes it's a reflection of the lack of communication skills between the two patients and the doctors here. And the second thing that I would like to point out is that the government here and all the organizations such as us is propagating a kind of a transparency and a certain minimum quality standard which accreditation provides. So if you could also tell your countrymen that they should never go to a hospital which is not accredited. So at least look for the minimum standard of accreditation. It does not mean that accreditation is going to solve all problems, but it's an internationally recognized, WHO recognized form of providing healthcare certification of a nature that will reduce the number of errors, and it looks at two aspects. One, because every hospital or every patient looks for two things. One is the hospital care and the other is the hotel care. So there is service plus medicine. There's no other industry which needs to do this. And I think we need to be cognizant of this and be very careful in advising our patients if they ask you, and similarly here, that we at least look for a minimum standard of quality mark. So I often say that if you look for a woolen garment, don't you look for wool mark? If you look for jewelry, don't you look for hallmark? Why don't you look for a hospital which has a mark of quality of providing good quality care? So I think that's the second part. Last but not the important point that emerged was about providing care there. But is it also possible to have a reverse flow? For example, could there be train the trainer concept, that your doctors may come here as observers to selected hospitals and be provided training as observers? Now this happens very commonly with doctors going from here and from the rest of the world to advanced centers in the West. Why can't it be replicated for our two countries here? So other than the educational part, there is also the experience part which you will get by watching someone who is going to be extremely competent in doing that. And then that link is established between those who come for observership and the person who is providing that observership. So you need to build trust, and it builds automatically. Last but not the least, I think we need to look at the individual laws of the country, as was referred in the morning session. What do you do if the patient goes back to your countries and the laws of the two countries are different? So if some advice is given on an e-platform, does it hold true of your country as well as this country? So those are things which probably a G2G discussion will solve. So it's not that the entire world of healthcare in India is private. It is largely government, but in the private sector for tertiary and secondary care or quaternary care, it is largely private. That is available to people from outside. But institutes which are institutes of excellence do provide care to anyone who approaches them. So that's about it from me, Raajiv.
Thank you, sir. I think points were noted well made. And that's the reason whenever we think that we need the words of wisdom, we always rooted towards. Thank you very much. Now, next I will just move to His Excellency Mr. Oumar, who is the Chargé Commissioner of Federal Republic of Nigeria. Sir, again, the question is saying that the most important is how embassies can help and facilitate. Sorry, I'll move to, sorry, my apologies. So, I move to His Excellency Mrs. Lalatiana from High Commission of Seychelles. Madam, the point is that these two countries have not progressed too much in the medical value travel. How do you think that both embassies can work together and increase the medical value travel between the two countries?
Good evening, everyone. First of all, I would like to thank FICCI for organizing this event and for inviting Seychelles to be part of it. I also join my colleagues to present condolences and solidarity to India for what has happened. Regarding the medical value travel between Seychelles and India, I think since my arrival 2 years ago, if there is one sector I have been working more is health sector. And so far, I have had many medical centers who have been to Seychelles, visiting, exploring the possibility to strengthen the relations between the two countries in the field. Because taking into account the location of Seychelles, yes, Seychelles is small, but the location is very good. We are located between Asia and Africa. We can be a hub. We just said that many people from Africa come into India for treatment. Why to cut the cost? Come to Seychelles. And for them to come to Seychelles, we need the assistance of India to set up in Seychelles a big hospital, a big centers. And not only Africa, Seychelles is a tourism destination. We have a lot of tourists from Europe. Nowadays, the medical tourism, Ayurveda, yoga, they would be happy to be in paradise, to be treated and follow the treatment. So it's another asset, another point that we should explore. So we can kill many birds at the same time, and at the same time to have exchanges between the health centers in Seychelles and centers in India in many aspects. For example, the telemedicine, the exchanges of doctors, nurses, we do need as well, and the training for new doctors or new medical staff as well. So between Seychelles and India, we can work a lot and we can achieve a lot. And I have started. I think present here there is a center who has been to Seychelles and who had a conversation on how to explore more and how to tap on these possibilities. So I'm still, as long as I'm here, I'm ready to have more conversation. Presently, there is a delegation in Seychelles, health sector again, doing the same, explore and discuss how to tap on in these possibilities. So welcome anyone who wants to visit the Seychelles embassy. We are small, but the last point that we need to consider as well, Seychelles is an open country, no visa required for any nationality to come to Seychelles. So there is no problem with the visa. You feel sick, you travel to Seychelles, and you get the treatment you need when the collaboration between the two countries can be ameliorated. And the language, we speak 3 languages in Seychelles, and almost 10% of the population are Indian origin. So Hindi is well spoken in Seychelles. Another point to facilitate the treatment and the communication. So welcome to Seychelles, everyone. Come to Seychelles.
Very kind. Thank you for your comments, and I think this is actually a good partnership, and we could see through that. Okay, so before I proceed to the next speaker, I just want Dr. Pastan to say a few words about, or any comments, especially from what Pam has told you.
Thank you so much. Basically, whatever you were saying, that was really correct, and we should go there and see. But the most important part, which you said, we were discussing from the morning that visa should be easy, and you are telling that there is no visa. So yeah.
Last but not least, Indigo started flying to Seychelles, and the fare is very nice, very good.
So actually, it's very lucrative offer, and I think now everybody start thinking about Seychelles. So because we really want to explore new destinations, and it was also good when we were talking with other ambassadors, that only heal in India is not enough, heal by India is also required. So we should think about that. Thank you so much.
Thank you. Raj, you want to say something? You told me not to put you in the conversation, but I thought a old friendship, I would love to put you in. What habits I have?
No, I had a pleasure of visiting Seychelles. I spent a lot of time in Mauritius. I stayed there. There are a lot of these countries where actually we can do heal by India very well. I had an opportunity to run a hospital in Mauritius, get a lot of patients from Madagascar to Mauritius and treat them there. So there's I think while we talk a lot more about heal in India, I think heal by India is a very big opportunity.
Thanks, Raj, and that's the reason I asked you, because you were very close to Seychelles on time. I move on to His Excellency Dr. Mohammed Eltom from the Embassy Republic of Sudan. Sir, you've heard the views from all the people, in fact, and there are common themes which are coming: trust, transparency, communication, ease of basically people traveling. In fact, I also I just want to understand that what do you think, how people can make this a better environment between India and Sudan as we continue to progress? And there will be a common question to all the ambassadors here and their representatives, that how we ensure that the doctors who are traveling to these to the countries, they are also protected, and there is easy licensing which can also be done so that people can go and practice. Because as His Excellency from Iraq said, that he would love to have people come and treat them in Iraq rather than everybody traveling. So I think everyone will have to create a situation where we are able to get the licenses in the respective countries. This is something which you can take back and talk to your ecosystem, how this can be done. So over to you, sir.
Thank you. First of all, I would like to join actually my colleagues in expressing my sympathy with the people and the government of India for the unfortunate incident, the terrorist attack in Kashmir. My condolences go to the families and the victims of this vicious attack. Also, I would like to thank FICCI for inviting me actually to participate in this important meeting. And it is as important to Sudan as well, because we in Sudan actually, we very much value India as the destination number one for medical treatment for our people. The same like my colleague here from Chad. India actually now, especially now, has become the first destination that people would like to go to for medical treatment for so many reasons. Not only the the financial affordability, but also for the quality of the services that they get when they come here. People are, I mean, in most cases, people are very much satisfied with the kind of treatment that they get from India. And especially in some cases, people first go to other places and then finally come to India. So when they come here, they get back well treated and very satisfied with what they get. So this is very important. I mean, in the official side, our government pays very special attention to India as well. And by the way, I'm very new in town as an ambassador here. I just arrived 3 months ago. And before I came here, actually, I had several meetings with our officials there, and part of that was the Ministry of Health. And they believe now, as you all know, we are actually undergoing a war in our country. We have a militia, unfortunately, which was part of our army, took arms against the government and actually trying to stage a coup d'etat in the country and started a war, which is going on. Luckily, things are improving. Our national army is making good advances, and we believe we are approaching the end of that war. That war itself actually made India as a destination for medical treatment, I mean, added to that importance of India. Now we have so many cases of those who were affected by, who have been affected by war, actually coming to India for medical treatment. So last year, approximately we have, I think, not less than 10,000 of patients visiting India. So that was, for us, it was a considerable number. People are coming, actually, not only from Sudan, but also from other countries where we have a big Sudanese presence. For example, like the Gulf countries. Some people are coming from the Gulf countries as well for medical treatment in India, so it's not only Sudan. And this is actually a good opportunity also to thank my colleague here from the Ministry of External Affairs. Their embassy in Port Sudan is doing a great job, actually, facilitating the visas for those who are coming from Sudan. Though I can say some words about the visa process when I'm concluding my remarks, because this is one of the areas that I think we need to also work on. My colleagues actually have mentioned, I think, some of the problems that are common, I mean, for people who are coming for medical treatment. For us, one of the big issues is the interpreters, not the quality of the interpretation that they are giving, but also because now they are representing a financial burden on the patients. Of course, they don't take directly from the patients, but I mean, the reports I got from the embassy here when I arrived, that now many of these interpreters are working like brokers for some hospitals. And the hospitals pay them. And of course, whatever they pay them, whether it is 20% of the bill or sometimes goes up to 30% of the bill. So the burden eventually actually comes on the patient. So this is one of the issues, I guess, that needs to be addressed. People have already mentioned the fluctuation of the bill. They start with a specific, and I think the doctor here made some good explanations of how or why the bill starts, for example, with a specific amount, and then in the process of the treatment, things may, complicate and get, so they need to add to the bill because they need to treat other issues as well while they are dealing with the main ailment that they have started with. But this is another issue, for us, because it is, people come with very limited budgets. And then when they get surprised sometimes by what they get from the hospital, and this complicates actually their treatment process. One of the areas that has been mentioned, but I think it needs to be considered, is joint ventures with some hospitals. I think one of the things that we can really look into, and I think the doctor here has mentioned a very good example of having a hospital in Seychelles, whereby it worked as a regional center for other countries around the area that can come and have their medical treatment in that hospital. I think Sudan can play that role. Sudan is located in the heart of Africa, and we have a long coast with Red Sea. We are connected to North Africa, to West Africa, to East Africa. So I think thinking of having a hospital there, and you can call it a regional hospital, whereby you can definitely serve other countries around Sudan. Sudan is actually is a neighbor with like 7 countries. 4 of them are landlocked. So it is ideally located for such an investment. Also, by the way, apart from medical tourism, India is a bigger exporter of medicines to Sudan. It is number 1 also in the volume of medicines that coming to Sudan. So this is another area of cooperation in the health sector. Of course, it's not part of this medical tourism, but again, if we think of having any kind of collaboration in this area, I think we can look at the broader picture, where medicines can come in. Also, we are actually thinking of, for example, other kind of, related to the health sector, like the artificial limbs. This is something that now, after the war, I think Sudan is in much need for it. We have some collaboration with India as well in this area. But actually, and now the government of India has generously actually agreed to send a team to Sudan. To operate there in artificial limbs. But I think also this is another area that we can think of. So there are good prospects of cooperation and collaboration in these areas. I think given the official policy of the government of Sudan now to have more cooperation with India, that will facilitate. And I think even the issues of the licensing that people have referred to, that for Sudan, I think will be easily handled, because it will be no problem at all, as long as there is a good interest from the part of the government itself in dealing with India in this area. So I mean, there are other issues mentioned by my colleagues. I don't want to go over them again, but I think also some of my colleagues mentioned the idea of opening offices. If not, of course, I mean, the first option or our preference is to have hospitals there, but if not hospitals, then let us have offices. The offices can play a very good role actually in, for example, giving more accurate cost, because actually that will be a direct communication between people there in Sudan and the hospital here, which has the office in Sudan. Also, for us, it might also eliminate this aspect of the brokers, because if they have an office there, they don't need to have, brokers here inside India, where people now can actually are giving our patients hard time, these brokers here in India. So these are the issues I think people can look into. As regards, the last thing that I would like to mention is the visa the process. I think it looks like there are some new requirements for the visa. Some of these requirements include the bank statement for the patients. This is something that I can tell almost 70% of the patients will not be able to produce bank statements because simply they may not even have bank accounts. Usually in Sudan, we have this culture of the Christian family, where you can find, for example, a person and if you who will take care of this, financial cost for the patients. So, he might be or she might be residing outside Sudan as well. So sometimes when people apply, this is a new requirement actually now. Definitely we can have a word with our colleagues in the Ministry of External Affairs to handle this, but these are things that might complicate the visa process for the patients. Thank you so much, and I'm sorry that if I did it one time, but I thought I need to go on to go over these issues because they are important to us. Thank you.
Thank you, His Excellency Dr. Mohammed. I think you summarized a lot of things which everyone has spoken about. And I think everything boils down to one thing is trust and transparency. If we can build an ecosystem which is trustworthy, transparent, I think there is no looking back for all of us to work together to take this industry to a different level and create an impact in our countries more every year, more and more year after year, so that we are able to treat more patients. I think that is what is the endeavor. And I think I would thank FICCI for organizing such a wonderful session of inviting and hearing your voices about experience. There are learnings. Everyone who is sitting here, people who are part of the ecosystem, they have noted down certain relevant points. Communication has to be sharper. The billing process has to be much smarter, much accurate. The surprises, nobody, when we travel personally as on our personal vacations, we do not want surprises in our pricing, even for the hotel and the food, then why we should give surprises to other people? As you mentioned, very important point, if people think that we all are in a profession, every professional has to improve his or her skill set. So even if somebody is in a medical value travel, it is important that we continue to sharpen our skills of communication or transparency, build that ecosystem. Because people are relying on you when they travel to this country. And it is our responsibility that we continue to give them a trustworthy service. So I think these feedbacks are very important, and we take this completely with the sincerity and honesty that we will work towards creating a better ecosystem. So before I end this session, I would like to invite Dr. Gangadharan to say the last commission of the words for such a wonderful session.
Yeah, thank you. Good evening, everybody. So, I think it was, I would say, you had a long day of deliberations on this important sector of medical value travel. And to sort of conclude today's deliberations, I know you have another session coming up, but in terms of the discussions, I think this was perhaps the last session, and I would probably say that this is like a cherry on the cake, because at the end of the day, they are the gateway or the access to the customers for the industry, right? So therefore, they have conveyed a lot of feedback to us in terms of what are the challenges, because often what happens is that when we talk about medical value travel, we look at the big picture, and try to highlight the numbers and then the facilities, how the sector is doing. But I believe it is also important to look at the process-related issues and challenges and see, how we can address that. I think in terms of understanding them, I think the ambassadors, who are present here have given us important, feedback, and all of them actually represent, countries which are crucial to us, in terms of attracting more medical tourists to India. So I would like to particularly thank, all of them for joining us today, and then, sharing with us, their views. As probably you also know, they are one of the pillars through which Ministry of External Affairs actually promotes, tourism in general, but also particularly the medical value tourism. But also our missions abroad, are another gateway through which we promote, tourism, and then often we do receive valuable suggestions, from them, which we actually share it with our interlocutors across the government departments, and also sometimes with the industry when we have that interaction. So, in fact, I just wanted to quickly, reflect upon a couple of issues that were raised by the ambassadors. One, in terms of, there was a request, for capacity building, from Our Excellency from Chad and also others. As probably you are aware, MEA is already, undertaking capacity building, for many countries in Africa. And that we believe is one of the important pillar of not just of our relationship with Africa, but also an integral component of we promoting India health sector abroad. So therefore, that is an ongoing process. And if there are more specific requirements, and then further expansion that you are looking at, we would be more than happy to receive that request and facilitate that. Also, there was an interest expressed by Excellency from Iraq, in terms of having Indian hospital there. Definitely, many of our leading hospitals already have presence abroad, and then that presence is actually growing. While our industry would be happy to have hospitals, abroad, we would also welcome, people from Iraq and other countries also to come to India for treatment and also explore the country, so that is the idea of medical value travel, to combine medical with wellness, and then also do a little bit of tourism. I think on the issue of hospitals, I think one of the important issue that needs to be addressed, His Excellency mentioned about the approvals or the regulatory related issues required for that. And another important component is actually the professionals themselves, because the reason why India today is known as a destination for medical value travel is because of its doctors. The quality of Indian healthcare professionals is something that has been attracting patients from abroad. But countries across the world, they have different regulatory systems when it comes to recognition of degrees. So therefore, I think this is something that needs to be looked at. So therefore, we can have some kind of an interoperability across countries when we move forward with proposals like this. So once again, I would like to thank FICCI for organizing and also putting a government representative in between the ambassadors and then the industry interaction, because it's been very useful for me to actually also get a sense of enough what's happening. Thank you very much.
What a thought-provoking discussion that we just witnessed. Let's again have a huge round of applause for all our excellencies here. Since we have 2 minutes, any questions from the audience?
What about the diagnostic centers, labs? That is very, very important. When the diagnosis is there, then only the doctor can treat it. So, the hospitals, yes, but diagnostic centers, labs also is very, very important.
I think, yeah, of course, I mean, diagnostic labs are very important, and we believe that should be part of the hospitals. But again, here, I mean, to start this process of having accurate diagnosis for the patients, if the hospitals could start actually by establishing diagnostic centers, for example, in Sudan, to make sure that patients get the right tests and examinations, and then, according to that, they will send, for example, the reports here, and then they will decide, I mean, how much it costs, and if it is possible. So that would be actually one step in first of all in addressing the issue of the fluctuation of the invoices. I mean, what people start with and then what comes at the end of the treatment. And number 2, to make sure that I mean, people have the right diagnosis before they come. That helps also the hospitals here, and will be the first step in building that collaboration with the country. In Sudan, I think now, again, with the war, 80% of our hospitals have gone out of service. So I think we definitely, for example, Sudan can stand as one of the countries where we need that so much, and we can start with any hospital here if they are interested in even establishing this diagnostic center, if not hospital. Thank you.
One more point is there. You mentioned the interpreters, they are working like an agent, and they are getting 20% or maybe 50% commissions like that. So in all the major hospitals, the medical representatives, the chairman of the hospital, the other bodies are there, where you find any things like that, they can complain there. The body is there. Legal bodies are there. The responsible people are there in each and every hospitals. They can complain there. This is my suggestion to you, please.
Thank you so much, sir. Indeed, a fantastic session that we just witnessed. Before we close this session, I would request Mr. Shan Pandita to please felicitate our esteemed excellencies with a small token of gratitude. Let's have a huge round of applause, ladies and gentlemen. It is our absolute pleasure to have you all with us. To our session chair as well. Let's have a huge round of applause.